According to the American Cancer Society, 53,000 people have been diagnosed with pancreatic cancer this year alone. Out of those 53,000 people, 41,000 people have died due to pancreatic cancer. Pancreatic cancer takes up about 7% of all cancer-related deaths. Pancreatic cancer is when cells move into the tissue of the pancreas. Risk factors can play a huge role in pancreatic cancer. Symptoms of pancreatic cancer are often mistaken as other illnesses. Research on the cancer has aided in properly treating the disease. This is a chart saying the cancers that kill the most people. Knowing more about pancreatic cancer comes with a better understanding about the organ and its functions. The pancreas is about 6 inches long and is located behind the stomach, close to the spine. Many people do not know that this organ is very vital in the digestive system. The pancreas is made up of 2 kinds of cells, exocrine and endocrine. Exocrine cells are responsible for making the pancreatic enzymes, while endocrine cells are released directly into the bloodstream. According to the American Cancer Society, cancer in the pancreas occurs when cells uncontrollably grow and multiply. It is important to know the difference in a tumor made of exocrine cells and a tumor made of endocrine cells. Exocrine tumors make up 95% of pancreatic cancers, while endocrine cells make up only 5%. The tumors that lead to cancer in the pancreas can be caused by risk factors in our lives. The Gale Encyclopedia of Cancer states that the susceptibility of getting pancreatic cancer can be heightened by certain risk factors, some of which are out of our control. A risk factor is defined as anything that can increase a person's chances of getting the disease. There are 2 types of risk factors: bad habit risk and hereditary risk. Bad habits can be risky, but can also be changed in the favor of a person and in turn lessen their chances of getting a disease. There are 3 bad habit risks: smoking, obesity, and exposure. Unfortunately, risk factors that are passed down through hereditary can't be changed and can pose a real threat. These 4 risk factors are diabetes, family, age, and inherited syndromes. Risk factors can lead to pancreatic cancer in the long run, resulting in 1 or more symptoms of the disease. The Cancer Treatment Centers of America says that most symptoms of pancreatic cancer may not be evident until the cancer has reached its advanced stages. This disease is so deadly because the symptoms don't show right away. People that test positive normally die shortly after because the disease is already in its latest stages. Pancreatic cancer kills very quickly. When symptoms show, they quickly affect the well-being of the individual. Symptoms include rapid weight loss, loss of appetite, blood clots, nausea, and vomiting. Recognizing the symptoms can help the diagnosis of having pancreatic cancer. Innovations are made to treatments constantly, and research has led to better and more effective ways to treat pancreatic cancer. The American Cancer Society is focused on finding better ways to treat pancreatic cancer. They're starting with innovations in radiation therapy and more strategic surgeries. Changes to the surgery help and aid in easier recovery. A Whipple procedure is the name of the surgery that removes cancer in the pancreas. It is a long, tedious procedure that takes a lot out of the surgeon and the patient. A long incision is made in the abdomen instead of short, simple incisions. A new approach to this method. The method is trickier because doctors will be using a small scope with a camera to look at tumors. Columbia Surgery claims that the average time spent in the hospital after undergoing a tumor removal in the pancreas is anywhere between 3 days and a week and a half. Pain can be easier managed in the hospital rather than home. Pain is managed at home through oral medications. A full recovery after being